Veterinarian featured in segments on KRCG 13's For Pets' Sake spoke with KRCG 13's Elizabeth Hoffman today. Liz joins us live from her home with that story.
Hey, that's right, Kermit. I'm actually on the floor because my dog was going to be in the shot, but she changed her mind at the last minute. But a lot of people are asking these days, can my dog or cat get COVID-19 while at home and then transfer it to someone else within our household? Now, Dr. Smith says there is no evidence that that could happen at this time. And we want to show you some video that we got earlier today. These are some pets around mid-Missouri, and as you can see, there are many of our furry friends that have lots of love right here in mid-Missouri. Now, Dr. Smith says she doesn't want people to become afraid that they will get COVID-19 from their cat or their dog, and because of that, abandon or relinquish that pet to a shelter. She says right now there just is no evidence of your loving cat or dog giving you COVID-19. However, if someone in your home has actually tested positive, she does have these recommendations.
Just like you are going to isolate yourself from your loved ones if you are symptomatic or think that you might have been exposed or might have COVID-19, you might want to bring your furry friend into isolation so you have something to snuggle with and comfort you, but your pet should also be away from you during that time so that they're not potentially getting the virus on their fur and then carrying it to other members of the household. Not so much that you're going to infect the cat or the dog, like kitty like Bruce here, and then the cat's going to get sick and infect a person, but if it's on his body somewhere just passively, could he potentially then go and play with one of my dogs or another member of the household, another human member of the household, and then expose it to them passively? That is something that could potentially happen, and that's where good hygiene and social distancing includes social distancing if you are sick from your furry friends.
All public and charter schools to remain closed for the remainder of the academic calendar, and the Jefferson City Catholic Diocese says its schools will follow suit. KRCG 13's Noah Brown joins us live after speaking with the superintendent of the Blair Oaks R2 school district about how his students and staff are handling the extended home stay.
Kermit, Dr. Jim Jones said that he and his staff found out about the decision to close down all schools indefinitely just a few minutes before Governor Parson made the announcement at his 3 p.m. press conference, and now the district is trying to figure out how to best serve its students.
Governor Parson said the decision was made after working with the state education department and several rural and urban districts. All schools have been advised to keep their original end-of-year dates intact and to continue home learning through that time. Jones said it's hard to see the year end this way, but that ultimately it was the right call.
The most important thing that we need to do is to make sure that we ensure the health, the safety, and the well-being of our students and our staff. And that's been the focus from day one as we've dealt with the coronavirus. That is the most important thing.
Before the announcement, the Blair Oaks R2 district had tentative plans to return in May, but Jones said doing so would make keeping students, faculty, and families completely safe and comfortable difficult.
Our job is to make the optimum educational environment, and we talk about physical safety of students. Well, we found out that COVID-19 is kind of a silent creation of uncomfortable.
The brunt of that discomfort is carried by the senior class. Jones said several events happen around this time of year to celebrate those who would be graduating.
Those things are going to be missed. Now we want to find out, what can we do to give all those students the closure that they need to celebrate the educational successes that have lasted 13 years.
Despite the inability to return to school this year, Jones said he's anticipating a strong finish to the academic calendar.
We're going to do our best and move things forward, and we're going to celebrate 1,234 students that gave us everything they had this year and 100-plus faculty and staff that gave us everything they had. This is not exactly how we wanted it to end. We don't always get that decision, but you know what? We're going to make the most out of it.
These boxes of masks, gowns, and gloves that keep healthcare workers safe are a hot commodity. Marcy Maddox is the Director of Clinical Supply Chain Operations at University of Missouri Healthcare. Her team of 64 manages the complex formulas that make up the supply chain system, looking at what's on hand, what can be purchased and when it can be delivered, and how much staff will need to care for patients.
We're learning from others. We're trying to be as proactive as we can to ensure that we can sustain the supply.
The health system typically uses 3 primary vendors for PPE, or personal protective equipment. But in recent months, buyers have had to innovate, vetting hundreds of new potential sources.
We get anywhere from 50 to 100 leads each day of new opportunities to potentially purchase PPE.
Branching out into industries like construction, cosmetology, even car repair.
We also reached out to all of the auto body shops in town who use respiratory systems or PAPRs, and we're able to acquire some via donation and via purchasing that way. So we haven't left any stone unturned.
To keep a close eye on the supplies already here, MU Healthcare has moved its PPE to central distribution locations, mini warehouses throughout the health system. Departments can request more supplies through an online management system.
That gives us more visibility of if we have a particular product that really we can only distribute so many of per day, we can better manage that.
From distribution sites, supplies are loaded onto trucks, ready for the delivery to the healthcare workers across the health system caring for patients.